Nice to see you, Dr. Maqsud.
Thank
it's
you.
an honour for you to be talking with us. So let's get in and talk about what Lives Lived Well does for the people to help break free from addictions.
Sure. In Lives Lived Well, we are offering varieties of services to our clients. Services like individual counseling. We also run groups, both for the clients and the families.
Yeah.
We have medical services.
Yeah.
We have residential facilities, rehab, in 3 locations in Queensland. People who think that they need residential facility to recover.
Yeah, and that's
from
very
their
important for
addictions.
people at the more severe end of the spectrum, isn't it?
Exactly. The common drugs these days, of course, continues to be alcohol, methamphetamine, ice, heroin, alcohol, tobacco continues to be the commonest drug, and the use of ice, interestingly, it seems that it is more common in the countryside areas.
The rural areas. That's
Rural
right.
areas
That's
in the
right.
countryside towns.
And you've been offering services in Mackay now for 12 months.
About
Yeah,
12
yeah.
months there.
And I can say it's been excellent services. So thanks very much for that.
Thank you. We offer our services from 62 Victoria Street in Mackay,
Yeah.
and also from the GP clinic in Urali.
Yeah. So the GP clinic at Urali does predominantly acute withdrawal, acute detox services. So that's excellent because that's a very important service.
Exactly.
And the rest of your maintenance programs are done from 62 Victoria Street.
Yes,
Yep.
and you can imagine the benefit, of offering service like in GP clinic, that lot of our clients, they can be restless and lack of patience, they don't have time to separately for counseling and then to doctors. And GP clinic Urali is a place they would be able to see the site nurse, they would be assessed by the health nurse and see the doctor
At the same time.
whether they need
That's
any
right.
kind of medication
Yeah,
during their
yeah.
withdrawal period as well.
Yeah. So that certainly seems to be working very well because obviously that's the City Super Clinic at Urali. They also have physios and other allied health
Exactly.
providers. So
Exactly.
people that are going through the acute detox can also get exercise programs to help.
And I think they're allowed to have 6 sessions
Yep, that's right.
for
Yeah.
the fitness program.
That's right.
And not to mention that bulk billing is very helpful as well.
That's right. They do commit to bulk bill all the services for patients going through the drug rehabilitation program. So
Right.
that's excellent for the patients. It does make it very easy to access for patients. So that's
Sure.
excellent.
It is very important for our clients to ask themselves that what drug and alcohol is doing to me apart from the physical and physiological complications. How it is affecting my behavior, and usually in a negative manner. How it is affecting my performance at home. How other people are involved in my life. How they are affected. People like my friends, my family, my neighbors, and I need to look at the safety issues as well. How drug and alcohol use is compromising my safety both inside and outside the home, the legal implications, how often I'm exposing myself to vulnerable situations, my chances of getting more aggressive, getting involved in all sort of domestic violence,
It's a big
neglecting
problem.
children.
Yeah.
So it is not only the body and mind. When we are looking at drug use,
Yeah, that's right.
there are a whole set of other issues as well.
Yeah, finances, legal, relationships break down,
Of
people
course.
lose jobs. Obviously, we'd want to get people to take action before their whole lives fall apart.
Oh, definitely.
Because I'm sure you see a lot of people where their lives have already fallen apart and you try to pick up the pieces.
Sure. And that is a very interesting point, because obviously the recovery process gets more and more difficult, more complex, and more time consuming when
The more severe the drug addiction,
Severe
the
addiction.
harder it is to get clean, is what you're
Definitely.
saying. Yeah.
Sure.
So stop early, don't let yourself get that bad because the recovery process is easier when you're less far down the track.
Exactly.
So
Exactly.
so take action early is basically what you're saying.
Very true. Ask for help
Uh-huh.
before it is too late. Often people ask their GPs, their doctors about it.
Mhm.
There are a number of community health center all around.
Mhm.
There are other NGOs.
Yeah.
Often they're referred by their probation parole officer if they're
Yeah,
involved
that's right.
with justice system.
Yeah.
And very often it is encouraging to say, I'm happy to say that often motivated clients, they refer themselves.
I mean, at the end of the day, GPs, psychologists or counsellors plus lives lived well.
It is very important, for a client to ask himself or herself that what kind of treatment will be suitable for me, and it is very important for people to tell themselves that I need to be honest
Absolutely. Yeah.
before I take
We
the
can't
next
help you.
step.
We can't help you if you don't tell us the truth.
Exactly.
Is the bottom line.
Exactly.
Yeah.
Start as well.
Okay.
It is good for them to remember that if they can work with mutual respect and trust
With
We can-
the professionals.
with the professionals,
Yeah.
we can expect the best results.
So what you're saying is that it's a team effort to get people
Sure.
better. The patient or the client needs to work with the professionals for their benefit.
Exactly. We can look at, grossly speaking, two processes. One is to keep away from drug use for the time being, and the other step is, once I'm doing better, how not to go back to drug use again. So it is very important to educate myself and also ask questions from the counselor about my pattern of use.
Yeah.
What time of the day
Uh-huh.
I get the itch.
Uh-huh.
Which are the places if I go, I am more vulnerable to use drugs.
Yeah.
Which are the people that if I meet, my chances of continuing is more.
So that's really talking about triggers. So what are the things that set you off to make you want to use? Where are the situations so that you can actively take steps to avoid those situations?
Exactly. The other thing I must emphasize is that the support system is very important for our clients. What kind of
Social support.
Social
Yeah.
support, family support.
That's right.
And without the support from friends, relatives and others, the task can become gigantic.
Yeah, that's right. Certainly having good support systems around the person makes a huge difference to success,
Sure.
doesn't it?
It
Because the
always-
people, they will need help when they're coming off drugs, because every bit of
Exactly.
help improves success rates. Professionals, especially the psychologists and team at Lives Lived Well, will always be working with the client to get them what they're trying to achieve,
Exactly.
won't they? So if it's harm minimization or if it's drug withdrawal, then you will work with them to keep them safe and get them clean if that's where they are able to go.
Right.
Yeah.
Once they stop for any reason, there will be varieties of reasons why somebody is not using drugs for the last 1 or 2 weeks.
Mhm.
They go through what we call the withdrawal symptoms.
Mhm.
It can be in the form of severe irritability,
Mhm.
anxiety, mood swing. They can be very sensitive and they can be very touchy, and they find it very difficult, even simple acts with their motor skill.
Mhm.
Memory, it can become a challenge for quite a few of them, forgetting things. We might have other physical problems as well, other disease. We might have other mental health issues as well. So it is very important to remember the medications I am getting from my doctor is not functioning 100%,
Uh-huh.
is not helping me 100% if I continue to use drugs
Yeah,
at
that's
the
right.
same time.
So there's two important points there that you bring up. One is if you're on medications from your doctor, you really need to talk to your doctor about what else you're doing with other drugs, isn't
Sure.
it? So that your doctor can give you help in relation to that.
Unfortunately, there can be severe reactions at times.
That's right. And the other issue that you're raising is the dual diagnosis, where people have both a mental illness and a drug addiction. and the two interact with each other and usually make each other worse, don't
True.
they?
We encourage clients to look for all these features because at times the mental health symptoms actually they can surface during the withdrawal period as well.
Yeah.
And I will refer back to our GP clinic and our complete service under one roof. That is the benefit of seeing a doctor while seeing counselors as well. It is very important for them to look at certain interesting phenomena, things like why they tend to go back to drugs when they meet certain people. Feeling wise, it is also very crystal clear that the state of mind is very challenging for some people. People can go back to drugs when they are very angry. Some will pick up their next dose of drugs when they are very bored and they are confused.
So, I mean, the common reasons for relapse would be people that you associate with, but you're also talking about boredom, anger, and stress, I suppose.
And that's why we emphasize, the need of getting active, picking up hobbies, even changing locations if you are surrounded by people you think peer pressure can be an issue.
And absolutely, I agree. I mean, sometimes you just have to tell people you've got to make different friends because those friends are going to push you down that same path. So if you want to stay clean, you've got to choose a different group of friends who don't use.
And it is a fact in life that it might be pressure from some very dominating friends, or it might be having good time with some very lovely friends. It can go either
way. Yeah.
The family support is one of the biggest things in their life, particularly when they are recovering. So families are always eager to help you because they will be simply delighted when they find another member of their family is totally committed, drug-free and functional, like other happy people in the community.
Yeah, all family members want the person that's using to become clean and become safe and become healthy. So they will take steps, as you say.
Sure.
They will go out of their way to help once you show commitment and willingness to take the steps.
Sure.
Honest communication from the patients to let us know or let the professionals know how they're going is absolutely critical because if they don't tell us, we can't help them. So if they're feeling depressed, if they're getting withdrawal symptoms, if they're getting cravings, please tell your professional because then they can help you. If you don't tell your professional, they can't help you.
Absolutely, and research has shown both in Australia and overseas that the chance of staying drug-free is very high if people get involved in exercise, in other recreational activities, in proper diet. These are all very helpful. They make changes in hormones in the body as well and in the brain, which has only positive effect.
That's right. So the exercise releases endorphins and gives you a natural high. You need those natural highs when you're coming off drugs in order to feel good in yourself because you're not getting that mood elevation from the drugs that you're not using anymore. So.
And then we learn and relearn that we can make ourselves excited, happy and smiling without using any drug. The effect apple, banana and pears can have on our mood is tremendous. It can actually boost you up and give extra energy. And we found that it is good to have those kind of fruits before going for an interview. And hopefully people listening will try that as well. The body chemistry, the blood chemistry certainly changes positively with any amount of exercise, whether it is 2 minutes or 30 minutes. Definitely. And my very simple message to all of them is we do have successful people who are motivated, who are interested to give up drugs and get back to life just like other functional, happy, productive people in the community.
And that's a really good message because drug use is a problem that can be solved. You can get over it, you can succeed, And if you need help, come in and see all the great therapists and professionals at Lives Lived Well. Thanks very much, Dr.
Thank you.
Yeah, thanks very much. Call directly to the 1300 number, 1300 727 957, or you can go via your GP or your professional counsellor and they can make a referral directly.